These are graphs that Jack Duncan and Andy Rux do daily for the school, and Maria posts these daily on our COVID website. As I'm going to show you in a separate summary, really for the first time in months, we are beginning to see some hope, some real trends. So this one is daily hospitalizations for the state. Multiple data points in the same direction equate to a trend, at least in my humble, unschooled epi opinion. But this is bolstered by that the number of testing being done has been relatively stable. The percent positives have come down. We see a spike at the very end of this graph, but there's a general decline, and I'll show you on another graph the same thing. And then finally, Alabama new cases, and the dotted line, the heavy dotted line, is the 14-day moving average. And there's a clear trend there, a clear decline. So these are both Alabama new cases. And here's Jefferson County. So again, a clear decline. This is the summary that comes out of Will Fernandes' office, and they asked me to provide some comments to it. And again, as I say in this, and I'll send this out in the Friday email, the last thing I want to do is hang a banner and say mission accomplished. You can't ignore the data, and the data indicate some very encouraging trends. The UAB census is moving in the right direction. Again, this is a different graph on state hospitalizations, but you see the decline. The rate of reproduction graph is really encouraging. It's below 1 for the first time since the 1st of October, which I think is really encouraging. Again, the blue graph showing the decline statewide in hospitalizations. Again, I think the Harvard Global Health Institute metrics, I think that ranking is an encouraging sign, simply because it indicates that we've gone from 78 daily new cases to 54 daily new cases. That's cases per 100,000. Here's another data perspective on the percent positivity, and again, that's declining.
I'm looking at our system right now, and I can tell you that to date we've administered 27,387 vaccine doses, and that includes doses into 15,986 UAB employees. And as I think I wrote last week, the residual doses that we've given were healthcare providers at other institutions that we vaccinated early on when their institutions didn't have vaccines, St. Vincent's, Brookwood, et cetera, as well as first responders and certain law enforcement entities. So those are the non-UAB entities that we have vaccinated. In terms of the activity going forward, all of the current doses in our refrigerator, which is 11,980, are committed to people UAB employees who are scheduled for their first doses, as well as taking care of people who are scheduled to receive their second doses. And that really puts our calendar actually coincidentally right out to Valentine's Day is when we will basically zero out all of the doses that are currently in our refrigerator. We do have, give or take, 1,500 doses that we received that were specifically for patients. Keep in mind that UAB receives vaccine in two different entities, one for our patient population and one for our employee population. And so on Monday, we opened up our Highland site to start vaccinating our patients who are 75 and older. We are doing 400 patients a day. And those doses will run out on Monday. In terms of looking at the future, we have an order for 11,700 doses that has made it through one part of the approval process. We literally just found out we're waiting for it to be approved by the CDC. If you're not familiar with how this works, basically the vaccine just shows up. You don't have a lot of warning as to when it is coming. It's not like an Amazon package that you can easily track. So the situation right now is we are not scheduling any employees or any patients until we have that vaccine in our freezer. And that's our procedure. We don't schedule doses for vaccine that we don't presently have in our hands. But as I said, our current schedule goes out to the 14th. So provided we get the vaccine sometime next week is what our pharmacy supply chain person is telling us, then we can resume scheduling with basically no interruption in our schedule. I think as I put in writing last week about, when can the campus population expect to be vaccinated? And I think I had said early March in a non-committal way. And I think that's probably reasonable. Still, looking at the progress that we're making with our patient population, the uptake in that elderly 75 plus group hasn't been exceedingly high. And we've run through a very large population of patients so far just to really vaccinate a small number of them.
This is the slide I shared Wednesday night with the students. It's a similar slide to what you've seen in the past, but with the data updated in the last 2 weeks. It's really looking much better. The cases are dropping rapidly. And again, if we look at what happened in the North, it's pretty, their pattern predated ours. So there's evidence that we probably are on a track to go down. But the thing I told the students, even with that, we're at the exact same case level we were at Thanksgiving. So if there were some kind of mass gathering and people thought it was a good idea to take off masks, we could surge right back up again. So it's important to keep in mind that we've got to stay vigilant. The one thing I added this time that you can take a look at are various key dates, because it is interesting, not necessarily causal by any means, but it's interesting to see that the peaks are surging in Alabama, at least following holidays or major gatherings of people. You could also add Memorial Day in right over here, because that's this first surge is Memorial and 4th of July. Then the governor issues a mask mandate on July 16th, and we start to see things go down. And then we see these peaks that continue to follow holidays. So we should probably be vigilant as a group and identify dates that we know when people get together for group activities and be thinking about what those are this semester and how they might impact. Martin Luther King Day was one that just passed where people get together to volunteer. I don't know about Valentine's Day. I've been trying to think of what holidays are coming up. And nothing jumps out at me, but we should think about it as a group to make sure that we just have a plan and thoughts around communication